I think this is the sort of million-dollar question in many ways. Right now, what we're seeing is a dramatic change in the way that obstetric medicine is being able to be practiced. So clinicians are unable to use their training and their expertise to care for patients to prevent known future health harms. What we see is that there are clinicians who, for patients who have a condition that's going to be exacerbated by the continuation of pregnancy, we've seen that these clinicians have advised their patients to travel to get care in states where abortion remains broadly legal. The same is also often available for patients who have a fetal diagnosis, where there's inevitable fetal or infant death. It's important to underscore, though, that this costs money, both in travel costs, paying out of pocket for getting this care out of state, and may also mean missing work, needing to find childcare. So for many patients, this is simply unavailable. And so these are patients who simply have to wait until they get to a point where their clinicians are legally able to offer them the basic standard of care. I think that clinicians can be really transparent with their patients, help them understand what is available to them, what other resources may be available to help them travel, what other resources may be available to help them offset the costs of childcare or missed work, resources including, for example, abortion funds. For patients in that second category I described, where they are in imminent danger, travel is typically not advised, since the emergency can come on so quickly. For these patients, they need to simply wait and be monitored. I think another thing that clinicians can do is help connect their patients with other kinds of emotional and mental health support, because these effects, these health harms, can have very long-running effects that happen even after the immediate health emergency is resolved. And many of these patients may continue to feel deep sadness about their pregnancy loss, alongside a range of emotions that could include anger, shame, embarrassment, and generally a feeling of distrust now of medical care, since they were denied what would be a basic standard of care to keep them healthy. One of the things that is really important for us to understand is how patients themselves experience these delays in care and these denials of care. Much of the research that has taken place so far has really looked at it from the perspective of clinicians. This is an important perspective because they have a deep knowledge about what would be the standard of care, what would be the consequences of delay and of denial. It's important now for us to pair that knowledge with talking to people on the ground who've experienced these obstetric emergencies and fetal diagnoses, who've experienced these delays in care and these denials of care, to understand not just the health outcome effects, but also the ripple effects into their lives and into their families' lives.